Hi viewers, cataract surgery is one of the safest and most commonly performed surgery. Have you ever wondered how the surgery is performed? Before we dwell into the steps of cataract surgery, let's look at understanding what is cataract. Cataract is nothing but opacification or clouding of a natural clear lens in the eye. This leads to decrease in vision. What do we do when a cataract occurs? We go into the eye to making openings and we remove the cataract which is white or cloudy and replace it with a clear artificial intraocular lens. This leads to significant improvement in visual acuity. In order to perform a cataract surgery, there are 5 important steps that we use. The first step is called corneal incision. Here we make a small opening into the black part of the cornea at the junction of the black and white part of it. So this is called corneal incision. This facilitates us entering into the eye. The size of this can vary as low as 2.2 millimeters to 3.2 millimeters based on the technique performed and the type of intraocular lens we are placing. In traditional phacoemulsification technique, we use blades and keratomes to gain access into the eye. Whereas in laser assisted cataract surgery, laser facilitates a 3-planar corneal incision with a span of 1 to 2 seconds. The advantage of 3-planar corneal incision is it is a self-sealing incision so that there is no need for sutures. There is no exchange of fluid from inside to outside or outside to inside, decreasing the risk of infection, and also there is less induction of astigmatism. The second important step is called capsulotomy. If you look at cataract is well placed in a bag. It's encapsulated in a structure called capsule. What we do is, in order to gain access to the cataract, we make an opening in the capsule. This is called capsulotomy. We have to make a very well centered circular opening of adequate size in order to facilitate removal of a cataract which is about 9 millimeters. This can be done in traditional phacoemulsification techniques using bent needle, it's called cystitome, or a forceps to make it round and circular. It's predictable most of the times, but laser has an edge, whereas in laser assisted cataract surgery, the capsulotomy is made as quickly as in 1 to 2 seconds, whereas circular central opening is made. Once the circular opening is made, we move on to the third step, that is making the cataract into fine cubes. Cataract is 9 millimeters. We cannot remove it through the 2 or 3 millimeters opening that we made. So we have to make the cataract into smaller fragments to remove it. In phacoemulsification, we use techniques called stop and chop or direct chop, and there are more techniques wherein using the ultrasound energy, the cataract is broken into finer cubes and this is aspirated later. Here also laser has an edge, wherein depending on the severity of the cataract and type of cataract, the cataract can be customized into finer cubes which can be aspirated easily, and the use of ultrasound energy can be decreased. The fourth step is aspirating the cataract or emulsification of the cataract cubes. Here what we do is we use some amount of ultrasound energy and aspirate the pieces that have been made to remove the entire cataract and clean up all the debris because of the cataract. The advantage of laser assisted cataract surgery here is the amount of ultrasound energy decreases and the risk of damage to the endothelial cells of the cornea decreases, and thus facilitating a quicker recovery. And the fifth step is implanting the intraocular lens. Here we get an intraocular lens which is about 13 millimeters in size. It is folded into in a cartridge and it is fit to a injector. So on this lens goes through 2.2 millimeters opening, and once it goes into the eye, it opens up. And we ensure that the lens is well positioned in the capsular bag, the place where earlier cataract was lying. So viewers, having all the steps performed very well, the intraocular lens can be placed perfectly well centered in the eye. If all the steps go well, I would say that the recovery is very fast and the discomfort that you'd have after surgery would be very minimal. At Pristine Eye Hospitals, we have the most advanced laser assisted cataract surgery system that provides you quicker recovery with very minimal discomfort. Thank you.